The Knowledgeable Provider podcast is intended primarily to entertain, also to inform, but it is not a substitute for actual medical training and should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, please make an appointment to see your own knowledgeable medical provider. The opinions expressed by me and anyone else who happens to appear on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than the lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. Look, this is all for fun, okay? Don't sue me. All right, on with the show. So one thing that I was not prepared for in my training was all the paperwork that you have to fill out in the course of taking care of patients and getting things approved and denied by insurance companies and FMLA, dealing with people's employers and health screenings, all kinds of things like that forms have to be filled out for. So I've got something here that I'm working on for a patient, and I thought I would just do it in real time and record it in case anybody's curious about what this process is like or what kind of things you're going to have to deal with. So the situation here, this is a patient that I saw 5 days ago complaining of arm weakness, neck pain, shoulder pain, and headache. It had been going on for several months and seems to be getting worse. There was a potential injury at one point where the patient was driving a forklift and hit a bump and kind of hit their head on the roof of the forklift, but the symptoms were clearly present prior to that incident, so don't know if that had anything to do with it or not. The patient told me that they can't lift any amount of weight above shoulder level. Once they get their arms up to shoulder level, they just become weak and they can't lift anymore. The pain that they're feeling is primarily in the posterior shoulder region on both sides. The pain radiates up the back of the neck and into the head. It hurts all the time, never goes away. It's waking them up during the night. A lot of times when they wake up during the night, they notice that both of their hands are numb, although they're not having any of that numbness during the day. Been taking lots of NSAIDs lately to help relieve the pain. This person has a history of degenerative disc disease, actually had a cervical fusion procedure about 10, 11 years ago. They have diabetes, coronary artery disease, hypertension, hyperlipidemia. So I examined them in the office, and there was some noticeable weakness with lateral abduction of both arms. So I had them kind of hold their arms up in a chicken wing position and challenge them, push down on their arms. And you could tell there's some weakness going on there. So I document all this in my note. I decide I'm going to send him for an MRI of his cervical spine to see if something's changed in there or see what's going on. So today I receive a letter from the insurance company, and here's what it says. This is directed toward the patient. It says, "Your doctor told us that you have neck pain. Your doctor ordered an MRI of your neck. By the way, I'm not a doctor, I'm a nurse practitioner. This test is needed when all following criteria are met. Number 1, your pain has not improved after 6 weeks of treatment. Number 2, treatment should include medications and other forms of therapy. These need to include home exercises or physical therapy. Number 3, your doctor can use the test results to decide on the best treatment plan for you. You may need to have a procedure or surgery. We reviewed the notes we have. The notes do not show that you meet all required criteria. As a result, the test is not medically necessary at this time. There's a number to call if you have any questions about that, and then there's a process for how to appeal the decision. It says 3 things to note. You have 180 days from receipt of this letter to file an appeal. If your health situation requires an urgent response, there's a number to call to ask them to review the case right away. And then we have a stack of forms. This whole packet is 16 pages long. So the first page of stuff to fill out is called a request for external review. The first question, is this request urgent? That's in bold, all caps, underlined, larger font. Urgent. Does the patient have a medical condition where the time frame for completion of an expedited internal appeal, parentheses, 48 hours, a final adverse determination, parentheses, 15 to 30 days, or a standard external review, parentheses, 21 to 45 days, would seriously jeopardize the life or health of the patient or would jeopardize the patient's ability to regain maximum function? Check yes or no. So now right off the bat, they're asking me to answer a question that I'm not super qualified to answer. First of all, I need an MRI to see what's going on in the neck and see how bad the nerve impingement is, right? I've done the exam. I noted that he has weakness in his arms. Is waiting 48 hours or 30 days or 45 days gonna set him back, gonna make it where he can't regain the maximum function in his arms? Yeah, maybe. I don't know. That's why I need an MRI and a neurosurgeon to look at it. So that's infuriating right off the bat because, first of all, you're telling me that I can't get the test I want, and now you're putting it on me to tell you whether or not you need to hurry up and think about it more. So I'm going to err on the side of checking, yes, this is urgent, because if my arms are weak because of something going on in my neck, that sounds pretty urgent to me. So I'm checking the yes box. So beside the yes box, it says, if yes, the physician's certification expedited review form is required. All caps, bold, underlined, larger font, required. Then there's a note. By requesting an expedited external review, you are waiving any available appeal steps and will not have an opportunity to submit additional information after this request. So they'll be glad to look at it right now, but then you can't tell them anything else. Or you can wait a month and a half for them to get back to you on this. So there's all these boxes to fill out. So here I go. And this is just a piece of paper. It's a Xerox paper with the inks all faded looking. Nothing high tech about this at all. I'm using my ink pen. I'm working at home, and I don't know if there's any point to this or not, but when I work from home, I always use blue ink just so that I know when I'm looking back at something, if anything ever comes up, like I didn't do something or I didn't have a resource or whatever, that's my way to know that I was doing this from home. Again, maybe not something that matters. I don't know. So I'm checking the yes box. We're going to fill out the patient information, which, this came from the patient's insurance company. So I feel like they could have already filled in these boxes, but I'm going to go ahead and do it here. Let's keep up with how much time this takes. The next section to fill out is insurance information for the patient. Again, this came from the patient's insurance company, so I feel like that could have already been filled in. I'll just go on and put it on here. You tell them, Billy. That's what I think about this too. The next section is healthcare provider information. That would be me. I always have to look up our stupid fax number because, I don't work in the office. It's just not my job, although it is, clearly. Not that I'm bitter about it or anything. All right, now we move on to reason for external review. If the denial reason is not listed, please call this phone number prior to filling out the form. Okay, let's see what we have. Medical necessity, pre-existing condition, rescission of coverage. Is that a word? Rescission? I don't even know what that means. And experimental/investigational. First of all, I'm going to look up what the hell rescission means. Okay, rescission means the retroactive cancellation of a health insurance policy. So I guess that would mean we ordered this test when they had insurance and now they no longer have insurance. Fortunately, that's not the case. So given those choices, I'm definitely not calling the 800 number to ask for more choices. So I'm picking medical necessity. Now we have dates of service and date of denial. I'm going to point out again that these are from the people who sent the denial. So I feel like they already know that information. Okay, so I saw the patient on the 10th. They did the denial on the 11th. I got it today on the 15th. That means 5 days have already passed. But they want to know if waiting another 48 hours is going to be detrimental to the patient or not. Okay, clearly very concerned about the patient. The next section is a big white empty box that says healthcare decision in dispute. Include any information you have about the healthcare services, supplies, or medications being denied. No Oxford comma there, I see. Interesting choice. Not my preference, but all right. Pretty sure these people read my note, so I'll just reiterate. MRI of cervical spine ordered due to cervical radiculopathy of, cervical radiculopathy with progressive myelopathy of bilateral upper extremities. Right. Important information. Filing deadline. You have 4 months to file your external review after receipt of the final denial letter, indication that the internal appeals have been exhausted. Expedited internal review for urgent care or life-threatening situations. These should be filed immediately following receipt of any adverse determination after the 5 days it took us to send it to you. It doesn't say that on here. I added that part. Please provide all additional information with this form. You will not be given another opportunity to provide this information. New medical information. Be sure to submit any new medical information that you wish to have considered. All previously submitted medical information will automatically be forwarded to the independent review organization by the health plan for consideration in this external review. There is the physician certification expedited review. I believe this is the required all caps, bold, underlined, larger font, required form because I checked the yes box on the previous page. Okay, got to put in the patient's information again. Got to put in my information again. All right, here's the pre-printed statement. I hereby certify that in my opinion, the above-named patient who has received an adverse determination for the medical services that I have recommended as medically necessary, I don't love that word recommended. I believe that I ordered this. Anyway, recommended as medically necessary requires such review to be provided on an expedited basis because a delay would seriously jeopardize the life or health of the patient or would jeopardize the patient's ability to regain maximum function, or in the case of an experimental/investigational adverse determination, that the recommended healthcare service or treatment would be significantly less effective if not promptly initiated. That is the run-on sentence from hell. So I'm going to sign that. I've gotten in the habit of putting the time that I sign things. Just another little thing I think might help me at some point if anything came back to bite me. Okay, the next form is Physician Certification Experimental/Investigational Review. The first form didn't say anything about this form, and I did not check the Experimental/Investigational Review box, so I think I'm going to skip this one. This is page 10 of 16, by the way. Here we have the Internal Appeal Request Form. I believe this is for the patient to fill out. The bottom part says Appellant Information. The name of the person submitting the appeal, the reason. I believe that's for the patient, although it doesn't really say that. So I'm going to go ahead and fill out the top part. Patient's information, again, including the policy number. I have to confess that this stuff makes me absolutely furious. I get so mad having to fill out these forms because it's all just a big old hoop to jump through so the insurance company doesn't have to pay for a stupid MRI. Absolutely ridiculous. There's this weird thing that happens sometimes in these situations where you feel like you're being asked to be a representative of the insurance company or the employer, where they're asking you, is this necessary? Or how much time does the patient need off work? Or what are the things that the patient is limited to? Or what can they do? And there's this weird thing that happens where sometimes you almost feel like you have some obligation to the patient's employer or to their insurance company to make sure that the patient's not trying to game the system or take advantage of anything. But don't ever get it twisted in your mind. Our job is to advocate for our patients and what they need. It is not my job to save some fucking employer or insurance company money. My job is to advocate for my patient, get them the things they need, and that's all. It's as simple as that. Sometimes you feel the same kind of moral or ethical dilemma when you're dealing with the drug reps, because they're always very nice, very bubbly people. They show up enough that you get to know them, and they bring you lunch, and they're super nice to you, and they try to make you feel like you have some obligation to them to prescribe their medication. And you cannot be taken in by all that song and dance. You have to remember that those people are salespeople, and it's all a big trick to get you to write their medication. And more often than not, the medications are good, and they work for what they're supposed to work for. Sometimes they work really well, but that's not always the case. Sometimes they don't work very well at all. They're always brand new medicines, so we don't have a lot of experience with them. They're always very expensive. All the stuff about how, nobody has to pay more than $25 for this, it's a bunch of lies. That's never true. Never forget that you do not work for the drug company. You do not work for the insurance company. You do not work for the pharmacy. You do not work for the patient's employer. The only person I have any obligation to in all this at all is the patient. We are here to take care of patients, to advocate for patients, to protect patients, and don't ever, ever, ever let any of this other crap that you have to get involved in distract you from that. All right, case information, dates of service, service from date, and service to date, in parentheses. I have no idea what that means. I saw the patient on 8/10, so I'm going to put that. Place of service, request ID, if applicable. Don't know if that's applicable or not. Don't know if I have it or not. No reason why I would have that. Oh, wait, hang on. Let's look back at the first form. Is there a request ID on here? There sure is, right there on the first page. Again, could have been printed on here. Date, service procedures non-allowed, parentheses, service actual end date. I guess that means the day they denied it. Again, also printed on your own fucking form that you sent to me. My name, again. So I'm going to leave the bottom part for the patient to fill out there. There's another information page here. If we have denied your claim for benefits in whole or in part for a treatment or service, rescinded, parentheses, see your benefit booklet for details, your coverage, or denied or limited your eligibility, this document serves as part of your notice of the denial decision. Your right to appeal. You may appeal if you think you have been denied benefits in error. For all levels of appeals and reviews described below, you may give a written explanation of why you think we should change our decision, and you may give any documents you want to add to make your point. For appeals, you may also make a verbal statement about your case. To send an appeal in writing, use the contact information above and include any added information you want to give us, as well as a copy of the decision letter or explanation of benefits, the reference number or claim number, parentheses, often found on the decision letter or the explanation of benefits. You might be able to find it here. You can get copies free of charge, oh that's nice of them, of your relevant claim documents, including the rules, codes, and guidelines we used in making a decision. All right, what happens next? We will send you a written decision for appeals that need medical review within 30 calendar days after we receive your appeal request, or if you are appealing before getting a service. All other appeals will be answered within 60 calendar days. Now we're out to 2 months, not just a month and a half. Okay. What happens next? If you qualify for this type of appeal, we will give you a decision by phone within 72 hours. There goes that 48 hours where something critical might happen. We're way past that. Your right to a standard external outside review. You may ask for an external review with an independent review organization if your appeal was denied based on any of the reasons below. You may also ask for external review if we failed to give you a timely decision as stated in the standard appeal section above and your claim was denied for one of these reasons. A decision about the medical need for or the experimental status of a recommended treatment. A condition was considered pre-existing or your healthcare coverage was rescinded. I like the word rescinded better than the one they used before. Unless your plan says otherwise, you have 4 months from the date you receive the decision to file your external review request. If you qualify for an external review, an IRO, which stands for Independent Review Organization, will review your case and mail you its decision within 45 calendar days. That decision is final and binding on us and you. Here's another box about expedited review. You can ask for this type of review if failure to get treatment in the time needed to complete an expedited appeal or an external review would seriously harm your life, health, or ability to regain maximum function. The request is about an admission, availability of care, continued stay, or healthcare service that you received with emergency services before your discharge from a facility. The request for treatment is experimental or investigational, and your healthcare provider states in writing that the treatment would be much less effective if not promptly started, or we failed to give you a decision within 72 hours of your request for an expedited appeal. Notice about provider appeals. If you used an in-network provider, your provider may be able to file an appeal request for benefits you've been denied. You and your provider may file appeals separately and at the same time. Deadlines for filing appeals or external review requests are not delayed by appeals made by your provider unless, all caps, you have chosen your provider to act for you as your authorized representative. Choosing your provider to act for you must be done in writing. If your provider is acting on your behalf, then the provider must meet the deadlines you would have to meet to file such requests. So if the patient wants me to act as his representative, he has to come to the office and sign all these papers. Additional rights. Oh, there's more rights. If you receive your benefits through an employer, you may also have the right to bring an action under Section 502A of a law called ERISA, E-R-I-S-A. To learn more, call the Employee Benefit Security Administration at this number. There's information about the Department of Insurance from the state this policy is from. The next box says, healthcare coverage is important for everyone. We provide free communication aids and services for anyone with a disability or who needs language assistance. We do not discriminate on the basis of race, color, national origin, sex, gender, identity, age, sexual orientation, health status, or disability. The only thing we discriminate based on is how much your stuff costs us. It doesn't say that. I added that part. If you believe we have failed to provide a service or think we have discriminated in another way, contact us to file a grievance. The Office of the Civil Rights Coordinator is provided. You may file a civil rights complaint with the U.S. Department of Health and Human Services, Office for Civil Rights, at this address, phone number, website, etc. The final page is instructions to call the language interpreter in 16 different languages that are provided here. How about that? Okay, that's all 16 pages of the packet. I believe I filled out my part, but I don't really know, because if you didn't notice, those instructions were a little convoluted. I feel like filling out taxes is much easier than that. So I think I said we started at 8:20. It's now 8:51. So that's half an hour of my personal time at home that I've spent messing with this. So now I'll put it all together tomorrow, which would be 6 days after the fact. The staff will fax all this in and we'll see what happens. All right, so this is day 2 of the paperwork purgatory, trying to get this MRI approved. I guess I should clarify that the stuff I was working on last night, half of that was for a state-run insurance agency auditing thing, and the other half was for the insurance company's internal audit. I don't think I really understood that until after I was already finished. So what happened today? I came into the office this morning, plunked the packet that I filled out last night into the little tray for the front office folks to pick up. And later in the morning, another big packet from the same place appeared on my desk with the same blank forms. And so, of course, I go storming up there. No, I already filled all this stuff out. But then I realized what had happened. I neglected to tell anyone that the patient had to fill out the rest of those forms. And I guess nobody else looked at it and just faxed it back into the company. So they sent it back saying that it was incomplete. And so it was no big deal to send it back to the patient. So now it's in their hands and we'll see what happens next. All right, so it's been a month at this point since I saw the patient, 29 days to be exact since I saw the patient. I realized today that I had not heard anything one way or the other about this whole situation. So I spoke with the patient's spouse. I said, hey, did he ever get that MRI we ordered? She said, no, they ended up denying it. And I said, well, I filled out that whole packet of stuff. She said, yeah, they still denied it. And so he just gave up on the whole thing. So it turns out all that was just a big old waste of time. I'm hoping the fact that he decided not to pursue it means that maybe his symptoms are better. She didn't mention anything about it, and I didn't ask. And it's sad to say, but I think this is probably pretty typical. I know there's been several instances where this has happened to other patients, and that's exactly what they do. They just sort of give up and fade off into the ether, and then the next time you see them, you talk about it again and make another plan and see how they're doing. But it's got to be infuriating for the patients when they've gone to see about a problem and a test has been ordered by the provider that they know, and then their insurance company just squashes the whole thing. Their insurance company that they pay all this money to every month. I don't think this has ever happened to me personally as a patient, but I can only imagine that it must feel very disheartening, disappointing. I would think something like that might make you lose faith in the whole medical system in general. And for this particular patient that I've been talking about, he really is not someone who needs to let that happen. He has a lot of underlying medical conditions that he really has not managed very well over the years, and they've kind of caught up with him now. And of all the people, we really don't need him to be the one who gives up on us altogether, stops coming for follow-ups, etc. So I want to take a look back at this whole situation now and have my own little M&M conference here, figure out if there's anything that I could have done differently or better to try to get this MRI covered for this guy. Before I even get started, I want to say that I completely disagree with the whole premise of this, that I as a medical provider need to become proficient in insurance and have to play this little game to get the tests that I want ordered covered for people. You see this all the time in notes from different specialties. The one that comes to mind most is the vein clinics. They see the patients, they do the ultrasound, and then invariably you get a note back that says, all right, we've got venous insufficiency, blah, 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 whatever the specific diagnosis is. I think what we ought to do is wait 90 days and try conservative treatment and then see how they're doing after that. That's the doctor jumping through hoops to get the insurance to cover whatever procedure they've already decided that they're going to do anyway. Sometimes you'll see that sort of thing in orthopedic notes too. Oddly specific comments about how long we've waited or how much conservative treatment we've done, etc. And so as far as I can tell in this situation, that 6 weeks of conservative treatment is really the big thing that is holding us back from getting the MRI done. And even though I wrote in the note that the pain has been going on for months and that he has been taking NSAIDs to try to relieve the pain, what they mean by 6 weeks of conservative treatment is the patient came in, was given some sort of direction about what to do, did that for 6 weeks, and then came back for another visit where we can say, okay, this didn't work. And by now, at this point, we're already 4 weeks out. So in 2 more weeks, I'll be able to see him again and then truthfully be able to say that we've tried 6 weeks of conservative treatment. I'm not someone who thinks it's okay to lie in order to get something like this done. I suppose if I had known in advance about this 6-week conservative treatment requirement, I could have finagled some way in my note to say that he was seen by an urgent care or an occupational health person and given a plan, and now we're at 6 weeks. Maybe I could have said that I spoke to him, even though there wasn't a visit. But even though, like I said, I don't feel like it's my job to save the insurance company money, I also don't want to go to jail for insurance fraud. So I do draw the line at lying like that. And that sort of begs the question, is it possible to know about these requirements ahead of time and know which insurance companies require what? It turns out that my personal health insurance is provided by the same insurer as the patient's. Different employers, different plans, so I don't know the specifics of his particular plan, but mine is administered by the same big insurance organization. And so I thought, hypothetically, if I was a patient who needed an MRI, is there a way that I could look up what criteria needed to be met in order for me to get that test? I thought the answer would be, of course not. It's completely opaque and you have no idea how they're deciding these things. But lo and behold, all I had to do was Google it, and it's right there on their website. You don't even have to log in as a patient to see it. They actually provide a very detailed list of every problem and every imaging modality and the specific criteria that they use to figure out whether a test is medically necessary or not. So if you are so inclined, it seems like it would be possible for you to find that information about your patient's insurance before you actually order the test to find out whether or not the situation meets the appropriate criteria. In theory, the patient could do the same thing, but the way that information is written, I think you have to be a healthcare person to understand it, because it's definitely not presented in layman's terms. But presumably, the patient could look at that in advance and tell you what they need when they come in, or bring that information to you in writing. I'm sure that most of us would not ever take the time to do that. I know that I never have before, but it is certainly possible. And really, in our practice, most of our patients are covered by the same handful of insurers. So it might actually be feasible for us to just keep a guideline posted somewhere of what things we need to make sure we're covering before we order these tests. In our office in particular, we don't have a big administrative staff. So maybe in larger operations where they have more clerical and administrative and billing people working on things, that would be something that you might get from those people. And really, I think that would be ideal if someone in your own office could look at your note and say, hey, you're going to have to make sure that you cover these things or add these things so that we know that this is going to get covered. But I would say in my practice in particular, I don't feel like that's really feasible. But in all fairness, I could have known the criteria in advance and made sure that I tried to cover those criteria or told the patient for sure, here's what we have to do before this is going to be covered. Another thing that became obvious as I was looking through all these criteria is that for this particular test, in this particular situation, it matters how they classify the patient's condition. So there are different criteria for medical necessity based on whether the pain is traumatic or non-traumatic, whether there are signs of radiculopathy or myelopathy. It seems like they're more willing to allow something like this if you can say it's from a traumatic injury. So he did have the issue where he hit his head on the forklift. And I suppose I could have written the note in a way that made it seem like that was the cause of his pain. Although when we were talking about it, he was very clear that the pain had started prior to that. And I was also very clear about that in my note. Again, I think that would fall under the category of just lying if you knew that information but intentionally tried to make it look like that incident was the cause of the pain. And then as far as the radiculopathy and myelopathy, I really don't understand how showing that he has weakness in his arms would not meet the qualification for either one or both of those. Under the heading of radiculopathy, it says that advanced imaging is considered medically necessary when the patient is a potential candidate for spine intervention in either of the following scenarios. So the first is radiculopathy with neurologic findings suggesting nerve root or cord compression that has not previously been imaged or has progressed since imaging was performed. And the other option is radiculopathy that has not responded to at least 6 weeks of conservative management. So if I had to guess, I would guess that they put this situation under the heading of radiculopathy that has not responded to at least 6 weeks of conservative management. Under the myelopathy heading, it just says advanced imaging is considered medically necessary for evaluation of myelopathic signs or symptoms, period. So really, I still don't understand why this situation doesn't qualify under one of those two things. When I look back and read my note, it seems pretty clear to me. I actually put arm weakness in the chief complaint I wrote in the HPI about his description of the weakness, and I documented the weakness in my physical exam. So that's the one part of this I really don't understand. That would be my main gripe with their decision that this is not medically necessary. And I don't know how else to really make that any more clear other than to document a very, very specific neurological exam that documents the specific muscle groups that are weak, along with grading that shows the weakness, whether reflexes were absent or hyperactive. Those are really the only things I can think of that might help. But even though I wasn't super specific like that, like you would see in a neurology or an orthopedic note, I still think I made it pretty clear that there was weakness. So I'm not sure what else to say about that. Another angle to go at this from might have been that he does have a history of cervical spine surgery in the past. And there is a category in these criteria for perioperative and periprocedural imaging, which says including delayed hardware failure or healing related to prior surgery, and it just says advanced imaging is considered medically necessary for diagnosis and management following non-diagnostic radiographs. I usually don't order a lot of spine x-rays unless I really think there's a big risk of a fracture, because it seems like overwhelmingly the neck and lower back issues that we deal with are due to disc issues or muscular issues. So I feel like unless there is some suspicion of a compression fracture or a pathologic fracture, or there's been a very recent traumatic injury that we want to rule out a fracture for, I don't really see much point in doing x-rays when you can just send the person for an MRI. But in this particular case, maybe if I had ordered a C-spine x-ray first and it had been non-diagnostic, he would have qualified for the MRI under that little section. So I guess moving forward for these situations, the things that I would think about doing differently would be writing a more specific physical exam to demonstrate any symptoms of radiculopathy or myelopathy, and consider doing x-rays before I try to order the advanced imaging. There's another resource that I want to touch on in case anybody's not aware of it. It's called the ACR Appropriateness Criteria, ACR being the American College of Radiology. You can go to their website, acr.org, and search their entire database of topics and ratings tables that breaks down all the different kinds of imaging, both diagnostic and interventional. They separate it out based on the parts of the body that are involved. So for instance, they split it up into breast, cardiac, gastrointestinal, GYN and OB, etc. And so if you pick a condition and click on narrative and rating table, you get a breakdown of what they consider appropriate versus not appropriate imaging modalities. So for this particular case, I would look under musculoskeletal. There's one category for suspected spine trauma, and then under the neurologic heading, there's a separate category for cervical neck pain or cervical radiculopathy. So I guess that would be the one I would pick. And so then you get these very easy to read charts, and it's broken down based on different variants of the situation. So the first option is new or increasing non-traumatic cervical or neck pain, no red flags, initial imaging. And it shows you the different imaging modalities, whether they're appropriate or not, and the statements they use there are either usually appropriate, may be appropriate, or usually not appropriate. And then for the different imaging modalities, they also give you a little visual indication of how much radiation is involved with that. So with this particular table, which by the way, I do not think applies to my patient that I've been talking about because of the red flag thing, it shows radiographs of the cervical spine as being usually appropriate, MRI of the cervical spine without IV contrast may be appropriate, CT of the cervical spine without IV contrast may be appropriate, and then all the other different options are usually not appropriate. And so that includes MRI and CT with contrast, CT myelography, CTA, discography, facet injections, MRA, bone scan, SPECT scan, and a few other things. And again, it gives how much radiation you're getting with each one. So like with radiography of the cervical spine, you get 2 little radiation symbols. With CT myelography, you get 4 little radiation symbols. It doesn't specify the actual dose that you're getting, at least not in this little table. It just shows you sort of relative amounts that they would be getting. The third variant might be a situation that applies to this patient. That would be prior cervical spine surgery, new or increasing non-traumatic cervical or neck pain or radiculopathy, initial imaging. In that case, radiography of the cervical spine is usually appropriate. CT of the cervical spine without contrast is usually appropriate. MRI of the cervical spine, either with and without or just without IV contrast, may be appropriate. And CT myelography of the cervical spine may be appropriate. Below the tables, you get a big summary of all the literature that they use to support their decisions. They do clarify that red flags for cervical or neck pain include trauma, malignancy, prior neck surgery, spinal cord injury, systemic diseases including ankylosing spondylitis, diffuse idiopathic skeletal hyperostosis, inflammatory arthritis, suspected infection, history of IV drug use, intractable pain despite therapy, or tenderness to palpation over a vertebral body. So in our patient's case, it seems like the prior neck surgery would make that a red flag. But then they also have a variant table specifically for prior cervical spine surgery. So I'm not sure how those two things square up. But anyway, in this situation, it seems like the MRI for this patient, based on the ACR appropriateness criteria, falls into the category of may be appropriate. So if you ever find yourself not sure about what kind of imaging to order for a specific situation, especially if it's a question about whether or not you should use contrast, these ACR appropriateness guidelines are really a good resource. And I don't know how these really relate to insurance coverage at all. This is really obviously this is a guideline from a medical society, so this may or may not help you out as far as insurance coverage. But if you are having to do some kind of back and forth argument with an insurance company about payment, it would be a good resource for you to say, hey, look, this does meet the ACR appropriateness criteria. I think I'm going to wrap it up here. I will update you in later episodes if anything changes with this situation. Hopefully, if he continues to have symptoms, we will at least be able to eventually get some imaging done and figure out what's going on. And I will report back. If you have any questions or have anything to add to the discussion, please feel free to email bkppod@gmail.com. That's THEKPPOD@gmail.com. All right, that does it for this episode of Knowledgeable Provider. I'm your host, Jody Marks. Thank you so much for listening. Don't forget to like or subscribe or follow and leave a nice 5-star review. And as always, stay safe, take care of yourself, and take care of your patients, in that order.